Hi, my name is Dr. Raja Adnan Ahmed, and I am a psychiatrist working in UK. And with me, I'm really pleased to have Dr. Rizwan Qureshi. And Rizwan is a consultant in emergency medicine working in Sydney right now. And the reason I wanted to get Rizwan on this forum is because I get a lot of questions from IMGs who specifically ask me that they want to come to UK after doing PLAB and getting GMC registration, and they then want to immigrate to Australia and make a career there. I think Rizwan was a very good example of this. Actually, he's actually done that. Rizwan came to UK. Rizwan is a graduate of Daw Medical University, Daw Medical College from Pakistan in Karachi, and he came to he did his graduation in 2001, and he came to UK in 2003. And then he, after getting the GMC registration, working in UK for a few years, in 2006 he immigrated to Australia, and now he's working as a consultant in emergency medicine in Sydney, which I think is a very big achievement. Let us talk to Rizwan and learn from him and see, ask him what can he advise the new generation of IMGs. Rizwan, first of all, thank you very much for joining me and giving me the time.
Thank you very much, Dr. Adnan. I think the pleasure is equally shared across the continents, I think, from my side as well, and across the different time zones. First of all, I think I must applaud you. You're in a time zone which is not biologically feasible. Yeah, it must be 1 o'clock in the morning, and while I'm starting here very early in the morning. But before, I think, thank you for very nice introduction. I think that pretty much sums it up in terms of my journey from the UK coming to Australia, taking all this professional and personal circumstances on board, and then somehow making them work in my favor. Obviously, this is something which was not easy, but it did have its perks. And I think it's all come to a point where it's quite yielding and quite professionally and personally satisfying. But I left UK 15, 16 years ago. And firstly, when you discuss that you want to, talk about this topic in particular about doctors coming over to Australia, going over to Pakistan, or going to Middle East from the UK, I was kind of perplexed that why is this scenario now so necessary to discuss? What is happening in the UK? Why do doctors actually want to move from the UK to other countries? And it's not just you. I've actually heard it from quite a few doctors, some of my few friends. Yesterday, one of my very dear friend has posted out a Facebook post that she's actually moving to the Middle East as an emergency consultant. So I think this is quite relevant. This is quite in topic. But what do you think, Dr. Raja? What are the various issues or problems, shall we say, that doctors are now really considering, not only considering, but moving away from the UK after a certain period of time?
So I think, in my opinion, there things have changed because I came in 2005, and when my generation was coming in, most of them who came with me, they used to talk about settling long term in UK and making a career here. But over the years, I can sense dissatisfaction among doctors for some reason or other. The factors they mention is that they think that life is very expensive in UK, although they get good training, they get paid well during the training, but when they are trained as a consultant, they don't think the quality of life, or at least the money they're getting, the money they're saving, is not enough. And they feel if they go to Middle East, they get paid much more, and money is tax free and they can save more. Then we are also getting feedback that some of our colleagues who move to not just Australia, to New Zealand, to Canada, other English speaking countries, are actually doing quite well. And I think economies of the other countries which were supplying doctors to UK, like India and Pakistan, has also changed a lot as well. The salaries and the middle class has grown in those countries. People who are trained, they can go back and set up some services. So I think those are a few factors. People feel the and government hasn't been investing in NHS as much. The salaries in real terms, in comparison to inflation, hasn't really gone up in the last 10 to 15 years. You earn all right, but then you end up spending a lot in UK as well. You can't afford a decent house. Sometimes, you struggle to afford a decent car. So those are the main reasons, people are actually looking for better options after they have trained in UK.
So I think you've actually summed it quite well, and some of these circumstances are actually quite relevant when I moved over from the UK to Australia. But trust me, my reasons were not financial because I was a junior doctor at that time, and I did not even know how much the consultants do earn up in two different countries. So finance seems to be the major role player. Right? What about the nature of work? In the UK. How do you think that's had evolved over the last 10 or 15 years? I mean, you've been there since 2005. What is your experience like?
So I think the nature of work is changing as well with time. I think NHS was coming under pressure. When I came, there was these issues around, like for example, if I'm talking about emergency medicine, A&E, what we call, the pressures on A&Es used always was a problem. Pressure on the beds in the hospital, pressure on admission, the waiting list, that was always an issue. But that has been getting worse over time. We used to hear that patients were waiting for 3-4 hours in emergency department to be seen, and then it got worse. And now we hear that they're waiting for 7-8 hours. The waiting list is getting out of control, especially since COVID. Things are becoming harder for doctors to manage, and the workload was increasing, and people felt that they are not given enough resources and enough money to actually cover that shortage, which has we have been experienced for a number of years now.
So you think that professionally the work obviously has become more complex. It's
Yeah.
certainly more busy over the years, and you're always tied up in some sort of professional issue. Now, one thing you've got to admit to the personal circumstances in terms of having, the diaspora from Pakistan, India, Bangladesh, and whatever the countries for the IMGs are, the personal circumstances in terms of having that desi population, that's surely got to give. I think that's got to be one of the most lucrable or lucrative rather issue that the people still would like to stay there because there are lots of overseas doctors there, and they have got communities and organizations, and they have got each other, if not in terms of professional satisfaction, they've got at least personal growth there. What do you think about that? Is
Yeah, I
that
think
something?
that is. I think that's when people are comparing Australia, Canada, New Zealand. They always say UK because it's a small country. Like for example, for you to travel to from one big city to another city, could be many hours. Sometimes you have to take flights. When here within UK, even if you are working in a rural setting, you are not away from a big city for an hour's drive. And as you said, there's a lot of what you call desi doctors or IMGs working in every hospital, even if it's rural setting or on urban setting. So you always find your peers, and you find it easier to make a network. And as you mentioned, doctors have been settled here for many years. Doctors from India and Pakistan coming to UK since 1950s and 1960s. So you find the third generation of doctors here as well sometimes.
Absolutely. Excellent. So let's take it further. Now, I guess your viewers are interested in finding out what would be the pathways
Yeah.
to come to Australia. And I can share certainly my journey, and I can update your viewers about the pathways which are available. And I've actually collated a little list, a little write up, gone through some of the things which may have changed. In fact, not a lot has changed apart from few little tweaks. But by and large, I think the things are similar in terms of licensing requirement, in terms of professional working environment, in terms of the prospect of getting onto the training and professional appointments, be it emergency psychiatry, general practice, or any other specialty. They pretty much remain in the same kind of figure. But let's start off with a question. I think question will help me lead because I've got this huge list of things and I could just rant about. What do you think what your viewers would like to know first?
So I think they would like to know if somebody has, because we have heard that if somebody has worked in UK after passing their PLAB for a year or a bit more than a year, they can go to Australia without doing any licensing exam, and they can get a license to work in Australia. So we just wanted to know if this is true, and if what kind of level they can start in Australia, and what would be their prospect for getting training and subsequent jobs.
Excellent. So yes, this is true, Dr. Adnan. They An average doctor who has worked in the UK for at least 12 months after passing PLAB 2 and has got full GMC registration is allowed to openly apply for jobs here in Australia. So that is the first and fundamental aspect of, if you're even thinking about coming over to Australia, to start applying for jobs. And most of the IMGs coming over from the UK tend to apply for jobs in three key areas: either emergency medicine, or that would be a general practice. And we'll come to the general practice area a little bit later, because the doctors who are coming in that category are fully qualified general practitioners who've been working in the UK. So these are the three key areas. Previously, what used to happen is that the doctors who were 12 months NHS experience, having passed PLAB 2, or they are UK medical graduates or Irish medical graduates or Canadian or US medical graduates, that is considered an equivalent health system. So these people would come in here, they will get an immediate ticket. They will get immediate full Australian registration, or general registration, which is called. So I think in GMC it's called full registration, while Australian equivalence is called general registration. So they would come and get immediately a full registration. And when you get a full registration here, I'm not sure about what's happening in the UK, but in Australia, if you get full registration, you can immediately apply for a permanent residency of Australia on general migrant scheme, because doctors are overall deficient. But Australian health system has learned from its mistake, because lots of doctors would come in, they get full registration, they would get permanent residency and nationality within a span of few years, and then they would leave. And it just create a bit of a mixed pot, and it was not working in the way it should. So what they've done is that, fine, you can come here, work on a conditional or a limited or provisional registration. These are the three grades: limited, provisional, or general registration. So you can come and work here in the category of provisional registration, which means that you have done 12 months of NHS work in the space of FY2 or foundation year Doctor 2. You at least work to that point. And then you will be required to work here for 12 months additional. And that would be in a general resident category. What this means is, during those 12 months, you do your assessment. There's a workplace assessment. You tend to know what the training pathways are for you. And after that 12 months spent here in Australia, you can then apply for a general registration. So I think it is somewhat different, but overall it's not much different, because most of the doctors who were coming from the UK, they were still requiring 12 months anyway. But now they've made it a mandatory requirement that even if you've got 12 months experience in the UK, you can come here on limited registration, do 12 months, and then apply for a general registration. So that seems to be the pathway. And this pathway is called competent-based authority pathway. So there are different pathways of registration through Medical Board of Australia. One is obviously the standard pathway, which is AMC1, AMC2, clinical, or WBA, which is mostly for the candidates who are coming, or the doctors who are coming from, third world countries, India, Pakistan, Syria, Afghanistan, Bangladesh, or any other part of the country, apart from the countries that I've mentioned in terms of US, UK, Canada, and Ireland. So that's the standard pathway. Competent-based authority pathway, which is that pathway we've just talked about, that you are graduate from either one of those four countries, plus, or either you've done PLAB 2, plus you've worked 12 months, and then you can start here and do a 12-month stint, mostly in medicine and emergency, and then you can apply for full registration. Now, coming to your second question, in terms of specialties, what specialties are available here for the UK graduates, you'd be surprised to know that most of the IMGs here are from the UK. And they are not just the IMGs in junior doctor grades. They are all the way up from junior doctor to middle grade to senior to consultant to director to health executives. So this is kind of system which has completely embraced the UK doctors. So if any IMG in the UK, like from the Pakistan, India, or any other IMG, who's thinking of coming to Australia, their prospect of gaining entry into any specialty is great. All right. Now, be it surgery, I would say, be it emergency, be it psychiatry, be it medicine, or be it general practice. The only requirement from the professional colleges now is that they have mandated that you have to be a resident, like a permanent resident here in Australia, before applying for one of the training pathways. When I came to Australia, it was not a requirement to join emergency medicine college on a full, you didn't have to have permanent residency. So there is no permanent residency requirement in emergency medicine, but there is still a requirement that you have to have a general registration, which is kind of the same thing, really. So, in terms of specialty, any specialty is a fair go for UK graduates, for the PLAB2 who have actually worked there. I think what I've seen recently, some of the UK people who have come here, they have come in with a bit more titrated plan. So they have thought in their mind, okay, I'm going to go to Australia. I'm going to finish the rest of my training in, emergency medicine, in critical care, in anesthesia over there in Australia. And they have done some critical care years in the UK. And it helps in two main ways. First of all, as I said, the system is exactly the same. And when you've worked in the UK, more titrated to the specialty that you want to specialize in, it gives you it gives you a head start when you're coming to Australia. So you are taken up as a registrar instead of a resident, and you can start off working as a junior registrar. Okay, that obviously smooths things over when you applying for general registration. You were already working as a registrar, which is partially supervised by the consultant. If you're thinking of starting a vast like a surgical specialty, they would have done a plastic surgery or orthopedic surgery or a neurosurgery or general surgery at least 2 or 3 years. And soon as they get their permanent residency and general registration, they would have a lot better opportunity to apply for general surgical training pathways after the Australian graduates have filled on those pathways. So that is the thing. I think four more specialties are the preferred specialties from the people who are coming from the UK. One of them is critical care pathway. So that includes emergency medicine or A&E, as you said. The other one is anesthetics. There are a lot of anesthetic registrar coming over from the UK, and ICU. The other thing is medicine and allied specialties. So in Australia, they just recently started to learn about the medical admissions unit, the chest pain units, and they're expanding their services from that point of view. So any doctors who's done MRCP, although the MRCP is not recognized in Australia, they would have done their MRCP. They would come over here and they would join the medicine and allied specialties or medical rotation as a junior registrar, as a senior resident. The third field, as I said, are the general practitioners. Now, in Australia, there's a dearth of general practice. There's huge opportunities in general practice, and there is a reason for that. I think I'm not sure how the general practice program now is in the UK, but in Australia, it's pretty much like a business for doctors. So the doctors who have moved over here from other countries in 70s, 80s, 90s, or even now, what they tend to do is they would open up a practice. Both husband and wife would work in a practice. Then they would buy another practice. Then they would hire doctors. So it's more like a business. It's like a business which is open and fair for everyone. In fact, one of our colleagues right now, he's from Iran. He's working he works with me. He's actually opened up a general practice, and he's an emergency physician. So opening up a general practice is a very, I won't say very easy, but very possible way of expanding yourself professionally and in sort of business like. And I've seen I've met recently a person from the UK who was doing MBA there. He moved over here, he married a doctor, and he's got 4 medical practices. And they're quite lucrative when it comes to the financial gains. So these are the 3 or 4 different key issues in terms of registration and specialties. And yes, that's the main issue. Now, there is other things which I have got written here in front of me, but I follow the lead.
Okay.
What question you got in your mind?
So with the GPs, the GP training pathway in UK is 3 years, and they can, after passing the exam, they are on the GP register. So those GPs who are qualified in UK, can they come to Australia and directly work there? Because we have heard recently that Australia were not allowing them to work in bigger cities, and they were asked to do some years or some time in rural areas. Is that right?
That's right. So there's a thing called moratorium. My wife works as a GP. She's a fully qualified Australian general practitioner. She's done all her exams here in Australia. But there's a thing called moratorium. And I think every overseas doctor needs to be aware of that. Now, moratorium is from the day that you're registered in Australia, you've got 10-year restriction to be primarily working in a regional or remote area. All right, to be eligible to be back allowed to be allowed back into a more cosmopolitan and more urban cities like Sydney, Melbourne, Brisbane, or some of the more populated regional towns. So that's a requirement for every IMG, and it's got its pros and cons. The pros are that once you go into the region, there's a lot more opportunity in terms of work. You get to choose your working hours, you get to choose your days, your shifts. There's a lot more opportunity, and you easily find a job there. Number two, it's financially heavily incentivized. So you see the doctors who are working what they call working out in the bush or working out in the rural communities. And that's not for general practitioners only. That's even true for other forms of pathways as well. They are heavily incentivized. So their contracts could go up to 500,000 to 600,000. I've heard if you go even more rural, it can go up to $1 million a year. So these are the places that they are very heavily incentivized financially, because obviously you're sacrificing yourself. So these are the two pros. Obviously, the cons are that, look, you're located out in a regional part or a remote part of Australia, which might not be accessible by road. Sometimes if you're really talking about really rural, it might only be accessible by plane. So you're secluded. And if you've got a young family, then most of the doctors who come over here, what they tend to do is they would leave their family in a more populated town, in the major town, even like Sydney, Melbourne, or Wollongong, or Newcastle, or somewhere which is more heavily populated, and they got desi population as well, and they would fly in and fly out. Hence the flexibility work.
Hmm.
So they would work for 4 days and be off for another 4 days. They would work for 4 days. Some of the doctors would correlate their shift. They said, okay, fine, I'll be there for 10 days straight, and then I'll be off for 2 weeks.
Hmm.
And especially in emergency, that seems to be the way to go. One of my friends who's working out in one of the regional emergencies, not even remote, in Goulburn area, they've got fly in and fly out doctors. Same in Dubbo, which is inner west. And these are not rural towns. They are good, big regional towns. They've got everything. Okay, they got hospitals, they got big, nice shopping centers, but most of the doctors in emergency in general practice would fly in to Dubbo, which is, I think, 1.5, 2 hour flight from Sydney. They would work there for 10 days and come back. And they're on permanent contracts. They're getting good incentivized pay. Some of them are locums who are actually getting very nicely reimbursed. So that's one of the things. So yes, moratorium is the real thing. And for the GP, it is also the requirement. And even the doctors who are taking the Australian training pathway for general practice, they need to train in what they call RAMA, rural access I don't know what the abbreviation is, but RAMA 1, RAMA 2, they're based on the perimetry of how far they are from the regional centers. So most of the IMGs who are on standard pathway, based on their performance, they would get, based on the performance in the interview of the selection process, they would get posted to RAMA 1, RAMA 2, RAMA 3, RAMA 4. And they would be located regionally or rurally. So that is one of the requirements, but that is, as I said, 10 years from the day you're registered. So some of the doctors, like my wife, was working 3 years in hospital medicine. So out of those 10 years, the 3 years are gone. So now you've got 7 years left. Sometimes there are exemptions as well, but don't count me for that, because they vary from person to person reasons. So if you've got any particular health requirement that you need to be in a major city because you need to be accessing the health issue, or somebody in your family has got health requirement, then you can be given an exemption. If your husband or your counterpart, like your partner, is working in the city in a full-time capacity, then obviously you can't leave here. Then you need to be justifiable within the range that, look, my husband is working in a solid fixed contract in this area, I cannot just locate. But this is something which is very gray. Normally, they would just not allow based on your partner working in full-time capacity in a city. So this is something which is, as I said, is taken on case-to-case basis. So 10 years just go past like that. Like we both been out of our own home country, Adnan, for more than 15 years, and it
Yeah.
looks like that I went to Australia. um, yeah. So yeah, so that's true. But then it's got allowances.
Um, and the other thing which a lot of people ask about the work-life balance in Australia, because again we are getting this message that the work-life balance is better in Australia. I mean, we can talk about the finances, how much you earn, and the cost of living appears to be cheaper. The weather seems to be better, and the I mean, working hours is another concern that do you actually get the similar working hours in UK, or do you actually work less and have more time with your family?
I think that's not true. The working hours is still the same as you would expect in the UK. So it's a 40-hour working week in terms of full-time capacity. But however, there are variations. Like I work part-time. I've pretty much worked part-time for the last 10 years of my life. And that part-time for me is like 30 hours per week because I've got other commitments. My wife works 30 hours, I work 30 hours. And plus, I've got emergency focus and I've got other teaching responsibilities and other things in terms of family. So I think it's variable. Yes, the maximum full time work is 40 hours per week. For that duration of time, you'll be busy at work, but not as crazily busy on most days as you're seeing in the UK, talking to some of the friends who are working in emergency there, that you are actually working flat out. Your waiting times are like in excess of sometimes 4 hours, 5 hours, sometimes approaching 6, 7 hours for the patient to be seen. It's not it's not that bad here so far. So Australia is quite good in the point of view that the emergency departments or emergency services are dotted across,
Mm.
ranging from from the city across all the way up to the rural community. So you will have walk-in centers, you will have GP emergency services. Plus a GP tend to do a lot. They've almost got like a mini medical centers which has got like every facility. They would have x-rays, they would have pathology, they would have ultrasound, like radiology, everything. So I think in terms of work-life balance, yes, you are meant to be working 40 hours, but you would not be as flat out busy as you are in the UK. You also get incorporated in that 40 hours if you're working on a permanent contract. You get given a shift once a week as your non-clinical day. So someone like me who's an emergency physician, I have one day as an office day. And I think same is in the UK that you'd get one
Yeah.
non-clinical shift and in any other specialty. So you can do whatever you want to do in terms of with the teaching, and that helps offset some of the tiredness. Um, I think where it balances out, Adnan, is that when you're working by choice 30 hours, the salary is still okay to sustain yourself well.
Mm.
There's not much of a huge, like there's not a huge difference between full time and 3 quarters.
Mm.
And the other flip side of the coin is the people who are by choice working half time, like 20 hours a week or 3 quarters. They are doing something else which would be even better paying than their public appointment. So Australia is a perfect balance between private and public work. So every physician that I've come, be it a psychiatrist, GPs obviously they work privately as well as publicly Medicare, but surgeons, psychiatrists, radiologists, physicians, they've all got private commitments. So they might be working 20 hours or 30 hours in a public setting,
Yeah.
and this will still be getting a good salary, but their 20 hours and 30 hours in a private setting would be double the amount of salary that they're getting. So it balances out.
And the cost of living, is that, I mean, you live in a big city, but is it, if you compare it to UK, we consider UK as one of the most expensive countries to live in. Is it the same in Australia, or you think you have more chances to save money? And
I I think you need to look at these numbers. I think UK is, in my experience, and some of the doctors that who have recently come from the UK, UK is relatively cheaper compared to life in Sydney,
yeah,
Melbourne. Well, Sydney, I would say predominantly, because look, I mean, I'm not an economist, but if you talk about the expenses of life, I think the ballpark figure is how much does the average household cost,
mm,
and how much does the average car costs. So average house in Sydney is over, $1 million now.
mm,
Uh, in fact, in the last 6 months, the house prices have gone up further by about 30%, and they never come down. So an average house in Sydney might be costing about 1.2, $1.3 million. House I'm talking, not an apartment, house I'm talking about. So from that point of view, the rents are high. From that point of view, obviously, your major chunk of salary might be going in the rental or paying up the mortgages. So that puts a lot more pressure on your pocket.
mm,
If you go up to the supermarket, the overall grocery bill is going to be 30% more expensive compared to in the UK. Australia, I don't understand why is that, because the produce, it's all Australian. So
yeah,
vegetables, fruits, wheat and rice and all those commodities, they're all Australian. Some of them are coming from China, obviously. And China is quite regional in this region
yeah.
part of the world. So I don't know why is this certain extra tariff 30% ballpark figure. So I think the life is expensive when you're living in the major cities like Sydney, Melbourne, Brisbane. Most expensive being Sydney, and especially the more closer you're living to the city. But when you go out regional and rural, that difference of a lifestyle in terms of price and in terms of economy compared to the UK, it tends to dilute a little bit. First of
Mm,
all, your rent is very, very cheap. You may have a big house and it may cost half the price what it costs in Sydney, or in fact, quarter the price. The rent would be very easily managed. So that's immediately that part of the salaries, that part of the expenses shrunk. The other thing is that you're getting paid, as I said, more when you're working in regional area. So from that point of view, your savings just completely paramount, because overall your salary is better here, much better what you're earning. So the doctors who want to save here, they by preference would work in the regional areas. Just from the point of view of saving, they've got their investment portfolios, they've got their property portfolios. They would by choice live in the regional areas because they're getting paid more, their expenses is less, and yes, so forth.
And as you were mentioning, the Desi population or IMG population, the immigrants in Australia, because when IMGs go abroad and they are settling in a new country, they sometimes tend to look for the communities they can associate with initially, especially in the initial time. So what is the situation there? You would you be able to, if you are obviously, I'm sure if you're living in a big city like Melbourne and Sydney, you'll find a lot of Pakistanis and Indians and all sort of different communities. But when you go to rural Australia, do you struggle with that, or is this becoming more multicultural now?
I think it's much, much better what is thought to be. When I moved here back in 2007, there were communities out here. They were sparse.
Mm,
They were quite dispersed.
mm,
But I think now with the organizational structure being reformed, their organization of doctors here, their organization of professional here, their organization. So there are lots of Desi communities, especially in the urban setup. So you'll come across many, many different areas. In fact, when I go to one of the areas where I buy meat from, you'd never come across an Australian there. It's
yeah.
just all Pakistanis, Indians. So you'd have areas in Sydney which are just completely populated or by preference by these
Mm,
Lebanese, these Vietnamese, these Pakistanis and Bangladeshis. So definitely in the major cities, it's not a problem at all. In the regional cities, one of my friends has actually relocated to one of the regional towns about 5 years ago. And he said to me that, Rizwan, my social life in terms of engaging with Desis is much better when I've moved into the region, because even though the community over there is smaller, they're much more engaged.
Yeah.
So when there are Eid get-togethers, they would all come, in a community hall and would have an Eid celebration. When there is Ramadan, then they would all come together and do Ramzan iftar parties. So this seems to be more closely knit. So I think, be assured, when you're coming in Australia with recent migration trends, you will not find yourself out cold in an area where you're not coming across
Yeah.
desi food, desi people, or your own professional community. You just need to find the areas where you're selecting to live for yourself and your family. And the circumstances are such, there are plenty of work opportunities in those areas
Mm.
in which there is desi population, if that's your preference,
Okay.
or within the easy commute. So in Australia, the road network obviously is very good. The air network is very good. You can easily commute back and forth within a span of an hour or a couple of hours.
So if I just clarify this again, so if I am IMG from UK is coming, a young IMG, for example, come here to UK after doing PLAB and we work here for a year or 2 years and then move to Australia, they will still have that condition that they can't work in a big city. They will have to work in a rural setting first for 12 months and then get their full registration and residency of Australia, and then they can apply for training while working in the rural setting, but not in the big city. Is that
Yeah.
what you?
So
Yeah.
the moratorium requirement are from the date of your first registration.
All right.
Now, there's a little bit of trick to it, Adnan, because when you're working in emergency, there's so many deficiency of doctors. There's so much deficiency of doctors in the major cities
Yeah.
that a doctor like me has done all his training in Sydney.
Yeah.
I never got to go to regional areas. Okay. Same in medicine. They're like geriatric medicine, MAU, same in anesthesia, especially for the UK graduates or UK IMGs, which I mean the PLAB 2 ones.
Yeah.
When they come to Australia, even though with the moratorium restriction is in place, it does not mandate you to go immediately rural. It wants you to work in an area, it is mandated to your 10-year requirement of being registered. Now that's for the hospital doctors predominantly. Okay, you're working in a department, you're working in an area in which they require your services. And the recruitment drive over here is that tier one are the local graduates, obviously,
Mm.
and tier two are UK graduates or doctors who worked in Australia. They are preferentially given priority when they're selecting. They look and they go through the CV and they find and shortlist people who have got UK experience. Okay, so they tend to get to fill up the jobs first. For GPs who are trying to train here, that is the fundamental word here. Who are trying to train here, they must stick to they cannot train in the city centers.
All
The
right.
local graduates can.
Yeah.
If you're trying to train on Australia and if you're a GP, then you have to go over to the rural area. That's almost
Mm.
certainly the case, unless until, as I said, you've got an exemption.
If you are a trained GP from UK, you want to work directly as a GP. Still, then you have to go and work in a rural area.
Good question. Now, one of my friends, who is actually my class fellow as well, who's come from the UK as a fully qualified general practitioners. And in fact, quite a few of my friends have come in that sort of ballpark figure. There's a thing called area of need.
Yeah.
All right. Area of need has got not geographical basis to it, but need basis to it. Now, area of need could be a suburb in Sydney.
Yeah.
All right. Or, 30 kilometers from the Sydney CBD, where Harbour Bridge and Opera House is.
Yeah.
That could be fundamentally classified as area. Now, so what is area of need? Area of need is that the population of that town or that area is such that the number of doctor ratios is not kept. Hence, the people who are living in that area, they're unable to access the primary medical care facilities. So doctors who's moved like about 3 years ago, 4 years ago, he's got his own practice now where I live in
Yeah.
Sydney. I'm only like 10 minutes from the airport, like Sydney airport. He's opened up his own practice with his wife. All
Yeah.
right. And he's working in categorically that area of need. All
Okay.
right. Same with one of my class fellows who's come here about, I think, 6 or 7 years ago. He's working in area of need in Sydney as well, which obviously classifies as an area of need. Now, these area of needs are rehashed every year.
Mm.
They're reviewed every year because obviously the doctors do come in and they fulfill that requirement. So these area of needs tend to get more and more farther away
Yeah.
every year. But there are constantly a requirement
Okay.
these days to have them accommodated in the major cities, especially if you're qualified.
And what is your experience? I mean, you must have seen doctors coming to Australia from UK. I mean, I'm just asking for your opinion. It might not be relevant to all of Australia, but are they generally happy there in Australia, or they ever talk about moving back to Britain or moving back to another country? Or, I'm trying to ask: is Australian system good enough to retain these doctors, or you are losing them as well, like UK is?
That's a very good question. And I think, Adnan, I always think that any migration or medical migration is not just a professional issue.
Yeah,
It's a combination of both personal, predominantly personal, and then later the professional issues. So
yeah,
we've got to understand this fundamental difference. In terms of retention, some of the UK doctors who are graduated in the UK, like from a UK medical school,
yeah,
they would come in basically on a working holiday. So they would come in, they would spend like 1 year, 2 year, 3 years sometimes. They would work in emergency, and they would work in emergency in a way that they would 6 months in Sydney, 6 months in Melbourne, 6 months in northern Queensland. So they're just trying to, work around and see the region. They come with very clear pathway that we are here for about 3 years or 2 years, and we're going to do as much as training we can do, because the training is accredited for most pathways in terms of general practice and emergency and critical and medicine as well. They can go and claim that training when they're joining pathways there. So they come in with the preset mind. They're dedicating 2 years or 3 years, and then they're going to go back. uh, the doctors in the same category who have migrated here,
mm,
from the point of view that they want to train here, they do so complete their training and they do end up taking the jobs. And that's the majority. And that's the UK graduates, medical graduates. Now, if it comes to an IMG in the UK, I have not come across an IMG in the major numbers. There might be a minority of numbers who have gone back to the UK. There is majority of IMGs who are here
yeah,
and they stay here. I think that's once you've left a country and then you are here for at least 2 or 3 years, then you get adjusted to the
yeah,
system.
yeah.
However, I have seen Australian IMGs who
Yeah.
have worked here for a number of years and then they've gone to the Middle East.
Okay. And the other thing I was going to ask you to clarify is, you mentioned that I think in your description that when a training post or training numbers are going out, so there is categorically clear that they will be first offered to the Australian graduates. Is that like, or Australian national Australian graduates? Is it right written in law, or is it something that you follow strictly, and then they will be offered to IMGs and doctors from UK or from NHS?
So that's a very good question. This is not a law. This is an understanding. So the law is that Australian permanent residents and Australian nationals, like citizens, are given preference
Yeah.
unless and until there's a suitably qualified candidate not available. So if
Yeah.
you've got two candidates who are both equal in their terms of their credentials, professional, educational qualifications are both equal. One has got, Australian citizenship or permanent residency, and the other one has got visa, then the Australian citizens would be given preference. So I think the main difference lies between the people who have got same credentials and they require visa to be able to take up that job.
Yeah.
And one is from the UK and one is through the standard pathway, then the UK one would be given a preference. And so such are the circumstances that there are jobs here, and those jobs tend to get filled not by these standard pathways, which is, I found it very hard, even though that they are permanent resident, they are Australian citizens, they are not given a preference. they are the UK people who are requiring a visa, they're given a preference because their credentials are strong.
Yeah.
So their credentials are working in the same health system, better communication. And to be honest, the doctors who have worked in the UK, you can see the difference when they come and work with you on the floor. They've got nice mannerism, they're very professional, um, across the board. So just it's not mandated. It's something which is understood.
Okay. Um, and I think just generally about life as a doctor in Australia. I think we covered that a bit already. Um, and you said we just wanted to know a bit more about life in Australia, because we are told that the weather is better, you do more outdoors, you get a proper summer there, which we don't get here. And you touched upon the work-life balance. Overall, what is I mean, do you think life as a doctor is quite fulfilling and enjoyable? I mean, I'm sure it will vary to person and their their ambition, and work life balance is again a very personal thing for everybody, and how do they explain that? But what is your impression of that?
Yes, you're right. It's very personal, and I think it's got its pros and cons, like anything else. And I think yes, it's given that overall the environment, the outdoor activities, the sporting activities, they are somewhat better because of the weather component of it. You got sun coming out, you got good amount of rain. There's good facilities in terms of outdoor activities, sporting activities. Obviously, if you come to the cities, then major cities are in par with any other major city in the world. Um, Obviously, they are the major cities. I would say, in terms of cons, they're not as better as in the European cities. So if you look at Sydney and Melbourne, although they would rank as one of the best cities in the world to be living in, those are hashed, or those are tracked based on multiple different issues, like in terms of crime, in terms of job, in terms of transport. They don't consider as such the IMGs, in
Yeah,
particular, the
yeah.
IMGs moving up to the UK. So yes, the quality of life is better
Mm.
when you have got livability, when you've got the weather, when you've got the outdoor activities, indoor activities, and the major facilities for the citizens in the major cities or in the regional cities, definitely no doubt about that. And weather has got certainly a very major factor to play in it. And I did not tend to think about it when I was in the UK. I just thought, okay, fine. Once I've left Pakistan, weather is almost secondary. But it is surprising how positive role it
Yeah.
has played in my development, in my mental well-being.
Mm.
And I don't know if it's true, but I've seen doctors, particularly myself. I was overweight, actually, quite heavily overweight. And in the UK, my lifestyle was very struggling. I was applying for jobs, I was preparing for interviews, and I was just stacking up weight. And when I came to Australia, everybody was like outdoors and
Mm.
into gyms and all that kind of activity. And not that I'm saying that it's not relevant in the UK, but there was a lot more opportunity. When you got bright sun
Yeah,
shining in your face, there's a very little incentive to stay indoors, right?
yeah.
So yes, that plays a certain role. And then if you factor that in with the local community and Desi community and Desi foods, it's I if you'd ask me, my personal opinion, I tend to prefer this lifestyle compared to the UK lifestyle,
Okay.
even though UK has got better Desi population. But in terms of outdoor activities and in terms of its regional presence, I tend to like Australia better.
And there are some other questions about the health system in Australia, because we are used to, I mean, different health systems. NHS is sort of free for everyone. So what is the? I just wanted to ask you about two things: the health system and the education system for kids. People will ask. So first, we go for by health system. How is it funded? And how is it for general population? How would it be if an IMG comes there and they are becoming unwell? Do they need to buy insurance, or how do they go about it?
That's a very good question. So, exactly like NHS is the Australian health system. So, the public health system is in comparison to NHS, if not better. In fact, I would say that in certain ways it is much better, because sometimes you get private insured people who would come into a public hospital as private patient. So they get priority access, priority rooms, and all that. Also, you'd see most of the public hospitals, there'll be three public hospital and then there'll be a private hospital next door to it. I think pretty much like in the
Yeah.
UK. So so there seems to be a good blend. So when you're coming as an IMG and you're not a national, but you've got UK nationality or UK passport, um, you would be allowed as a reciprocal arrangement to be able to access the Australian health system for
Okay.
free. So that's called Medicare access. So there's a Medicare card which gets given to you for if you're a permanent resident, if you're an Australian national, or if you've got a reciprocal health system to one of the developed countries. So when the
Yeah.
Australian citizen would go to the UK, they will have a obviously free national health system. To the US, I think I'm not sure if the US people are allowed, but some of the other countries
Yeah.
they're allowed to have a free. Uh, so the people who have not got UK permanent residency, they would have to purchase a family medical insurance, which on an average for a family would cost about $700 to $800 a month.
Okay.
Now I know it's pricey and it's something which comes out of your pocket, but it might be only for about a year or two. As soon as you're able to get your general registration, apply permanent residency, you can apply for a Medicare. And it's not that you are given a permanent residency; it's from the date of application.
Hmm.
So your decision may come like 3 months or 2 months ahead, but you'd get given a Medicare card from the date of your application.
Application. Okay. What about the education for the children? If we talk about the school education and the university education, is that free or do you have to pay for it? I'm sure there must be private schools and all that, but generally speaking, is it something that when the IMGs come, do they put their children into the free schools?
Yeah, so public schools are the preference for most IMGs, and they are now recently a trend of an intermediary fraction. So there's public school and private school. Private school obviously is very expensive. They've got fees like for a high school, typical fees would be between $40,000 to $50,000 per annum.
Hmm.
All right, that's a private school for girls or boys, from year 7 to year 12, and that's just a school tuition fees. If you've got other expenses like excursion and other things, uniform, syllabus, and all that, that would be on top of that. So you're looking at 50,000 to 55,000 per annum for a private school fee for elite Sydney, or Melbourne or major cities. That is kind of thing. Then there's public school system, which is very good and it's completely free.
Hmm.
And in fact, most doctors prefer their kids to go through the public health system.
Hmm.
And they said, okay, fine, if they need some extra help, we would put him in a private health system for the year two. There's also now an intermediate pathway, and we've seen schools which are private or semi-private kind of thing, and their fees would be a fraction of a cost of a private health system. So there would be Islamic school like Malik Fahad Al Nouri School, and their fees is like $5,000, $6,000 per annum, which is a lot more palatable.
Yeah.
And there's also some other schools, schooling system which would be semi-private, and they would also have similar kind of fee. They're more religious schools in that sort of segment,
Yeah.
but their fee is much more less. And some of those schools, mind you, they've ranked very well um, uh, in the results for the year 10 and year 12. So this seems to be now a hot favorite kind of thing. You've got a waiting list to get into those schools. The one point I would like to raise, that if you're not a resident of Australia,
Yeah.
and you're not a resident of UK, I'm not sure, then you are, and you need to put your kids into a public health system school, you need to pay a fee.
Okay. All
So
right.
if you're not got a permanent residency, that school fee is about $2,000 per 6 months. So it's not a big fee. It's
Yeah.
like $5,000 per annum. But if you're not a permanent resident here in Australia, you are meant to be paying a fee if you're an IMG
So until you get the permanent residency.
until you get the
Mm.
permanent residency.
And the universities, because that's the thing. Universities in UK are getting expensive for children. It used to be much less expensive. Some areas like Scotland is still giving free university education. Um, what is it like in Australia? If you are an Australian national, if your children became Australian nationals, do they get free, or is it cheaper to put the children in Australian universities?
No, it's not cheap, Adnan. It's quite expensive, and I think the fee is pretty much. If you look at the industries, I think UK, Australia, New Zealand, um, even Malaysia to some extent, these are the countries in which health and education are the industries.
Yeah,
So they earn. So right now, because of the COVID, there's an estimated like billions of dollars of loss per annum by the university, because the international students are not able to come join their programs. So it is quite expensive to. I'm not sure exactly how much, but it's same in the same figure as the UK figures are. There is no free university. However, there's something called, HEX kind of thing, in which you're entitled to apply. If you're a permanent resident, you can apply for a loan from the government, and based on that loan, you can, you don't have to pay any fee in there. Some of the IMGs and the university students who come from Pakistan, they tend to come here with a year's worth of savings, or 6 months worth of saving. And soon as they come over here, like in the UK, they tend to join, odd jobs or Uber Eats, and they tend to, and that's pretty much the way to go here. When you are even studying medicine, you're doing Uber rounds, and you're doing some other jobs to partly support yourself, which I think is a very good way of
yeah.
learning the people management skills.
So, Rizwan, thank you very much for all this information. Is there anything else you want to add, or is you think I've missed, or any relevant points you may have written which you think may be useful for IMGs? You can share that now, because my questions have run out. To be honest with you.
Yeah. So there's one particular path which I'd like to highlight, because I think the doctors who are IMGs and coming from the UK, they are mostly in two categories. One of the categories is that they've been working for 2 or 3, but they're not yet specialists that we have talked about. They need to
Yeah,
come in through competent authority pathway. These are the doctors who've done PLAB 2. These are the doctors who've done foundation year 2, or at least a couple of years after that. They're the doctors who've got best chance of taking up, good jobs here in the system in terms of critical care, general practice, medicine, surgery, even if they've got that kind of credentials building up in the UK, and they come through the competent authority pathway. And after, as I said, coming over here, after 12 months, they can apply for general registration and then permanent residency, and everything is hunky dory. The other pathway is for the doctors who are fully qualified, someone like you,
mm,
or someone like the fully qualified GPs. That's called a specialist pathway, and that's much more streamlined. So they don't have to do any more additional exams. They would still have to do assessment. So for instance, if somebody is fully qualified general practitioner, fully qualified emergency physician, or fully qualified anesthetist, they would apply directly to the college. All right, to the College of Anesthesia, to the College of Critical Care, to the College of Intensive Care, Emergency Medicine, General Practitioner, and they would have their experience and qualification accredited. Now, this application process is expensive. Sometimes it may cost between $7,000 to $10,000 per application, but they would review your application, and they say, based on your experience and your qualification, you are recognized to be working in a specialist, as an independent specialist in Australia, after 6 months of supervision, after 3 months of supervision, after 12 months of supervision. So that's all individual based. That's the purpose of application, because they would grade your level of seniority and in that way. But you can then directly apply for a job based on that. And we've got lots of doctors who are working in our department who have come from the US, from the UK. They don't have to redo any sort of exam like AMC exam or a specialist exam. They come and do their work-based assessment, and then they are able to gain full registration. And their full registration comes in a lot earlier. It would come in like within 6 months or within 3 months sometimes. Especially again, if they're working in regional areas, they would get that kind of advantage. And that is something to consider. And there are a lot more opportunities for fully trained doctors, like in any other country. If you're coming from, there's always a dearth and more demand for doctors who are fully trained, especially in general practice, emergency medicine. Psychiatry is a big field now,
mm,
which is deficient. There's recently lots of budgeting which has gone into mental health. pathways at regional level.
Mm.
So these are the kind of people who are in hot demand.
So if you, this is a very good point you've raised. So you've described two different pathways. One is for IMGs who are sort of younger IMGs who done maybe internship in their own country, a few years of work, and then come to UK, do PLAB, GMC registration, work here for a few years, and then go to Australia and try and get on the Australian training system. That's, you describe one group of doctors of these, and then you have other doctors who are IMGs, but they came to UK and actually they have completed a training here, so became a CCT holding doctor, could be in emergency medicine, in general medicine, psychiatry, anesthesia, and then they go to UK. So you are saying that the doctors who are fully qualified are have more chances, or they have, their life would be easier in comparison to the ones who are actually going to Australia and then trying to uh, um, seek for training there.
I think life would be relatively easy compared to the fully qualified one. Obviously, if you've once you've done the exam, but you need to check which specialties are accredited.
Yeah.
So I don't think there is an accreditation for medicine and surgery.
Mm.
But there is an accreditation for emergency medicine. There is an accreditation for intensive care, anesthesia, general practice. So these are the specialties. There are even certain specialties who are time accredited but not exam accredited.
Okay.
So someone who's come from Pakistan, having had worked in pediatrics and radiology, their time would be immediately accredited. They just have to do fellowship exam.
Okay.
And that holds true for many of the UK specialties. So pretty much in a ballpark figure, you would be at the same level. For them, the life would be easy, yes, for the specialist part. But even the people who are coming in after 1 or 2 years of work in the NHS, their life is not that hard.
Okay.
And I'm using as a rhetoric in terms of doctors who are coming through standard pathway, who are permanent resident, who are Australian. Their life is hard,
Mm.
especially if their credentials are lean.
Mm.
They have got career gaps. They've got not much activity happening in the 5-10 years. They've been pretty much isolated. Compared to them,
Mm.
if you're working in UK health system, you're pretty much guaranteed a job
Okay.
because you are not allowed to come to Australia. The pathway that you need to take is you need to apply for a job first. So the
Okay.
first step for anybody coming to the UK, they need to apply for a job.
Mm.
Once they get given a job, then they are able to apply for registration.
Okay.
So that is something which I want to make it very clear that for the UK graduates or the doctors who are working in the UK, they need to apply for jobs through their locum agencies, or they need to apply for jobs directly through the state health websites. And only after they've been given a job, then they need to apply for registration. So it
Okay.
is quite good from that point of view, as
Okay.
compared to IMG, which is completely you need to go apply for AMC, Epic, and then AMC 1 and AMC 2, and then all that kind of
That's correct.
pathways.
Okay. And then you mentioned the other terms you mentioned, which is important. You said you use the term time accredited. Your training could be accredited, but not your exam. So there are certain specialty you're saying their exams are accredited as well. So if you take an example of A&E, so if you are a qualified A&E consultant here at a level of, you got CCT, you pass all your AMC exams, then you can go and work in Australia as an emergency medicine consultant. You don't need to actually take exams again. Is that what you're saying?
That's absolutely true. So if you're fully accredited CCT, Certificate of Completion of Specialist Training in
Yeah.
the UK, and if you've passed the fellowship exam, FRChem, all components of it, then you can come and work here as a specialist after a brief period of observation or supervision, which might be 3 months or 6 months, depending on the mix of your, tertiary level work and non-tertiary level work, because they want to see that you are trained in the same framework as the Australian framework, and they may give you 3 months or 6 months. But yes, you are able to work, and that's how most of the UK doctors are coming. They have done their main fellowship exam. I'm not talking about now. There is another thing with the UK. There's membership examination
Yeah.
like MRChem and MRCP. Unfortunately, they don't mean anything here in Australia. All right, they're not recognized to work as a consultant. In the UK they are, as a locum consultant or something like that, but here they're not. There's only one one pathway to consultancy, that's CCT
Okay.
equivalent. In Australia you have to have completed complete training in the actual scripted prescribed pathway, and
Yeah.
then only you can become a consultant. There's no other
Okay.
pathway.
So, but as you said, you need to check that which training and which exams are accredited. Not all of them are accredited as same from
Yeah,
like automatically will be accredited if you are from UK.
that's right. That's right, Adnan. From my understanding, emergency medicine, general practice, anesthesia, ICU, I think pediatrics, psychiatry, these are the five ones which are I've seen doctors working in that capacity. But for medicine and surgery,
Yeah,
you may still have to find your radiology might be the other way. But because these are very much in demand, they've got a lot of private work, and you are pretty much able to come on a very good and lucrative salaries,
yeah.
and you can establish your own private work. And so I think that these specialties which would require you to pass an exam.
Okay. No, thank you very much, Rizwan, for your time. And I think this was a great discussion. I'm sure a lot of IMGs will be getting benefit from this, and then it will clarify a lot of doubts in their mind. At the last, I just wanted to ask you one more thing. I know you running. I've seen your page for emergency focus, and you're doing a lot of events and things through that. Would you like to just explain that a bit? What is that, and how is it? How can it benefit doctors who are actually following you through the social media?
So emergency focus is something that I started out a number of years ago as a pet project to train doctors over in Pakistan. And that was out of my frustration, Adnan, because when I was a house officer as a resident in Pakistan, I did not have an access to good courses, or if there were courses, they were far and few. And I thought, okay, fine, why don't I take the qualified doctors from here, formulate a course which the college allows you, and then accredit the course and do that in Pakistan. So we did that. And then the COVID came around, and obviously we're not able to take the course as we were in the last 2 years. So our focus has drifted to the IMGs now here in Australia. So we're helping the IMGs here to do orientation programs. So they are equivalent to clinical observerships. So in the UK, it's easier to get clinical observer position or clinical attachment position. But in Australia, it's very difficult. I mean, it's possible, but it's very difficult. So I thought that the doctors who've been here, and they've got large career gaps, they can come and join our 8-week programs, and it's just a complete revision of entire medical curriculum from the practical point of view. Like when you're working the floor, how do you see a patient? How do you investigate a patient? How do you manage a patient? So those kind of very core stuff we teach through our courses. Plus, we're also helping IMGs with our Australian Medical Council courses, AMC2 clinical courses, like PLAB2 equivalent courses. So that's one thing. The other thing is that I'm also doing practical courses for IMGs here, and that practical course is done in one of the hospital that I work in, the clinical simulation center. And then there again, based on the skills, like how to learn basic skills that you need as a resident. If there's a ward medical emergency, how do you provide basic airway support, basic circulation, basic cardioversion, ALS, BLS. But it's all focused in a point that once you've done that 2-day course, you feel that, okay, fine, I've learned something. If I'm thrown out in the ward and there's an emergency, I should be able to survive the first 10-20 minutes of that emergency. Plus the communication aspect. There's a huge deficiency when it comes to communication, not in only in terms of understanding, but also, trying to alleviate some of the concerns of the patients and their relatives. So it's been very good from that point of view, and we've got good response and good feedback, and hopefully we can continue to work with the same zeal and commitment.
So, Rizwan, thank you very much for your time and all the information you're given. I will share the emergency focus page with this video when I post it on YouTube and also on Facebook. But I'd like to thank you again for giving us all the information.
No, thank you very much, Dr. Nan. It was a pleasure, and I think that was one of the very long-waited meetings, and me and you talking. And I'm so glad that we had this conversation.
Oh, thank you.